Hello, my name is Michelle Johnson. I am a registered nurse. I attend University of North Carolina at Charlotte and also Western Carolina University. Today I'll be talking about abortion, a policy analysis with you. The variables of the abortion policy. Does the current reporting policy protect the vulnerable? Do the current resources meet the needs? Does current policy discourage women from having abortions or have children? The problem statement. Who decides what constitutes abortion? And when does this decision infringe on a woman's right to abort a child or have a child? The background. Why is this topic important? Laws vary from state to state and even different on a federal level. Why this topic was chosen? An effort was made to reveal opportunity to improve application of this policy. Definitions. Federal and state laws differ. 18 to 21 until 1973, all 50 states had laws. Uniform Abortion Act paved the way for other acts to be formed from various countries. Who? Department of Defense, Assistant Secretary of Defense, Office of Economics, Health, Education, and Welfare Department, Center for Medicare and Medicaid Services, CMS. From the previous slide, this is what the Who's are saying. They said that people can have abortion for medical reasons. They said it may be performed in military medical facilities in the U.S. No project funds may be used for any surgical procedure intended to result in abortion. Has no policy for or against the performance of abortion. Who has the right to say? This has been a big controversy over the policy of abortion. The Catholics has always had something to say. The militant minority male groups had something to say, and women also has something to say about the abortion policy. The government definition of abortion. Abortion is defined as the termination of pregnancy by various methods, including medical surgery, before the fetus is able to sustain independent life. By looking at this slide here, this is the statistic of abortion in the U.S. Um, as you look at the color code in the bar, the highest one here is Texas, and it's 93.3% abortions there. And the second highest is California, 49.9% abortions are there. And this is the maps of percentage of pregnancies aborted in the U.S. Now, the statistic reason for abortion, as you look at this chart below, this of the United States, abortion laws before Roe, illegal, 30 states is in the red. Legal in case of rape is one state in the purple. Legal in case in danger of woman's health is two states is in blue. Legal in case in danger of woman's health, rape, incest, or likely damaged fetus in 13 states is in green. Legal on request, just requesting for abortion, is 4 states and is in yellow. These are the states that abortion are performed, and you can look and see by the colors how many is was before and after the Roe decision. Government intervention for the abortion policy. Hyde Amendment withheld federal Medicaid funding from abortion nationwide, federal abortion banned, and state abortion restrictions. Policies. Roe versus Wade, and when the U.S. Supreme Court federalized rather than nationalized abortion policy, with results that states were given parameters in which they could develop their own abortion policies. As you can see here, some of the states developed some parameters, such as physician hospital requirements, gestational limits, partial birth abortion, public funding, coverage by private insurance, refusals, state-mandated counseling, waiting periods, and parental involvements. And these are some of the parameters that some of the states developed to go along with the abortion policy. Important aspect, key stakeholders, women and healthcare professionals, key factors, what constitutes who should answer for a woman, stipulation of an abortion, resource available for women. Having an abortion. Only 9 states ban all or most abortion. 3 states ban most common method of second trimester abortion. 2 states lengthen the waiting period and reduces resources are available when women are contemplating abortion. Recommendation for the abortion policy. Policymakers should not include provision in healthcare policies that allow providers to refuse service based on conscious claims. Where laws that permit refusal are in place, governments should strictly limit and regulate the use of conscious claims and enforce those regulations. And laws and policies should never allow institutions to refuse care. Policymakers should establish regulations that shift the burdens to those who deny care. Recommendation continue. International agencies and professional organizations working in health should take a clear position that refusal of care based on personal belief is unacceptable. Treating monitoring bodies should further elaborate on how refusal to provide care specifically violates certain international human rights. Use of courts and human rights treaty bodies to establish limits on providers' ability to refuse care based on claims of conscience. The DNP essential. For this policy analysis, Essential 5 and Essential 6 is utilized in this policy. Essential 5 is recognizing and identifying problems with the policy. The DNP education prepares the graduates to seek change on a larger scale. By identifying strengths and weaknesses of the policy, positive improvement is possible. Essential 6 is collaboration between interprofessional teams such as the physician and the government can be led by DNP students and nurses to reach positive and impactful outcomes and focus on patient-centered. Conclusion. Prior to 1973, abortion was illegal and was only applicable legally as an option only when the mother's life was in danger. However, the Supreme Court ruling on Roe v. Wade would change all this. Women perceived the ruling as liberating to them. However, the legalization of abortion came with its own controversies, and it has even been labeled a social issue in the United States and the world over. Nevertheless, the DNP graduate is able to design, implement, and advocate for health care policy that address the issues of social justice, such as this abortion policy.